Diabetes type 2 is on the increase, and it's very important for people to know this because diabetes type 2 is preventable. And the way to prevent it is to know as much about it as you can. And basically what we do is we offer information to people so that they know that type 2 diabetes is hereditary, and they have it in if they have it in their families, then they know that they can actually get it, because if you have a relative with type 2 diabetes, you already have inherited a 25% chance of getting diabetes. But if you have two relatives with diabetes or two parents with diabetes, you have an 80% chance of getting type 2. So there are preventable actions that you can take, and the reason why we raise the awareness is to make people become more knowledgeable and empower themselves to be able to avoid this disease, which is preventable. In Gibraltar, there is a very high population of type 2 diabetes. This is about 10% of the adult population has type 2 diabetes. And the problem that we have in Gibraltar at the moment is that in order to be able to empower people with type 2 diabetes, they need to have structured education at the point of diagnosis. And unfortunately, this is not happening at the moment. The NICE guidelines and Diabetes UK recommends that people who are diagnosed with type 2 diabetes are looked after by the diabetes nurse specialists, and they have, at the point of diagnosis, they have a group education with other people who have diabetes as well, and they learn about the foods, they learn about the carbohydrates, they learn about exercise, prevention and planning to be able to empower themselves so that they do not get the complications of diabetes. And unfortunately, this is lacking. There is no structured education. There is no forward planning with the people with diabetes, and the diabetes nurse specialists do not have the structure in place to look after all the diabetics, and unfortunately the GPs don't have the time either to dedicate the education that the patients needs, and therefore at the moment the care of the diabetics in Gibraltar is suboptimal, and that is why we are raising awareness, and we want to push for the government or for the GHA to start educating the diabetics from the moment that they are diagnosed, so that the complications of diabetes are avoided, because the complications of diabetes are an impact on the GHA. They are an impact on hospital admissions, length of stays in hospital, and early death. So to avoid this, we need to start educating the people from the point of diagnosis.